Okay, welcome to another review for our practitioners from the Philippines. So, we would like to acknowledge the presence of course, Sister Rosa, whose lecture on suicide is highly anticipated. So we're finalizing the date. Hopefully, we can push through with December 1. And please keep updated with the final schedule. No, definitely it will push through. It will be Sister Rosa is also an MD, a doctor. Wow, serving the Lord at the same time serving the people. So please, we're looking forward to that suicide thing, no? Because we see a lot of people with suicidal tendencies. And then, of course, it's nice to see that all of us are safe. And let's get back to work. Okay, so today we shall be trying to get used to um, looking at the tongues of people with lung yin deficiency. So this can develop when you are sick during the course of illness or when someone has kidney yin deficiency. All know that the kidney and the lung, they have like a mother and son relationship. So for someone who was not too fortunate to be born with kidney issues, you will definitely have a lung yin issue, no, lung yin deficiency. Lung yin deficiency is an important causative factor of isolated lung yin deficiency, and which is smoking. So smokers out there, you know what you're into, what will happen to you, no? Over long term, we all know that smoking is, it generates heat in the lung. And so when there is too much heat in the lung, there will be clumping of lung fluids, okay? And that clumping will actually give you problems. So the pathology, when someone has this kind of cough, which we commonly call smoker's cough, is what characterizes the lung yin deficiency. So it typically occurs in the morning. So the phlegm is quite thick and discolored. Okay. So that's what we call the smoker's cough. So many years of smoking will lead to dry or irritating cough. And this is because of the fact that the phlegm is drying up. And the lung heat, the heat in the lung, as you can see from the slide, will show in the anterior third of the tongue, and it will be red, okay, because of the heat, because it's lung heat, no? So if the more advanced stage of injury to lung yin, um, you will already see small thin cracks. So, which means to say that if you already see cracks here, you have been having that for quite some time already. Okay. And the color of the tongue body is very red. Okay. Now, another cause of lung deficiency is when you used to work in environments that are very dusty and dry. No? So, like, for example, if you are a baker or a miner, I know of one uh, baker. He actually owns the bakery who died of lung cancer. So, bakers and miners. So lung yin can be injured by external dryness. So that's dryness coming from outside. So if you're exposed to very dry weather, or when you have central heating and also air conditioning. Did you know that air conditioning can give you dry skin? No? Now, dryness in the lung. So when do you know? When do you say that a person has lung dryness or dryness in the lung? The cough is dry, and when you look at the mouth and throat, they're also dry. Okay. So when someone has lung yin deficiency, there is hoarseness. I see this often in teachers, especially when they retire. No, they never recover their voice back. So itchiness of the throat, and occasional blood-tinged sputum, no? By the way, not everyone with lung yin deficiency has TB, okay? So it can also be due to overuse of the voice, like probably you are an opera singer or a very good singer, no? No, or someone who uses his voice all of the time. Feeling of heat in the body. So these are the people who would complain, it's so hot, I feel so hot, or there is subfebrile temperatures in the afternoon. So they would always tell you, why is it that I would have low grade fever in the afternoon? It's not really high fever, no. So they will always tell you when like at 3 p.m. they start noticing that they feel hot. Okay. So if the tongue is dry and you don't see any cracks there, so that's dryness in the lung. But if there is already intense red discoloration of the tongue body, okay, you have both lung and kidney deficiency. Now, there are some people who were probably not too fortunate to be born from parents who were probably very sick, no? Or probably their parents were already old when they were born, okay? So you will have kidney yin deficiency. And when you have kidney yin deficiency, you will be predisposed to have lung yin deficiency. So if you are a teacher, a singer, or an actor, you can have lung qi or lung yin deficiency. Okay, so it starts off with lung qi deficiency, or then it can progress to lung yin deficiency. Overuse of the voice will actually lead to weakening of your zong qi. Remember your zong qi, the gathering qi. The energy controls the strength of the voice and influences speech as it supports qi of the heart and lungs. So if you have a patient who speaks very softly and without any emphasis, no, or probably who is hoarse, you will probably consider this diagnosis. So what are the early signs of gathering qi deficiency? So can you see the picture here of the tongue? There is depression on the anterior third, and the tongue body is pale because that's deficiency. So you expect a pale tongue body. Okay. So this one is a little bit swollen. Yeah. However, when you look at the lung area, your third, it's a little bit, there is depression. So such individuals are prone to catch colds or they will have trouble with their voice. Okay. So gathering qi deficiency is often accompanied by symptoms indicating heart and lung qi deficiency. And if you are sad all the time, um, yeah, and also grief, no? When you are in grief, when you are grieving, that means you lost something, you lost somebody. Sadness, probably you're just hungry all the time. Okay. So in grief, there is always an element of loss. So you will have this tongue sign. So if the patient tells you, "Oh, I don't have TB, I had my lungs checked. What else? I don't smoke, but he is sad all the time, or he has been sad for like number of years." I had a patient. She was in her 70s, and 15 years prior, she lost her husband, and she told me she never cried because she could not accept the fact that her husband died because of a heart attack. You know what happened? Her voice was very inaudible, no? And she also had a heart attack. I hope she's still okay. Okay. That was a long time ago. So that's why I'm very, very particular about emotions, no? Sadness, what does sadness do? It disperses your lung qi. That means it makes your lung qi disappear. So you will have lung qi deficiency. And remember that the lung and the heart, they work together. They belong to um, they're called the ancestral qi, no? The zong qi, diba? If something goes wrong with the heart, there will also be a problem with the lungs, and also vice versa, no? So if sadness and grief remain unresolved for many years, lung qi deficiency may evolve into lung yin deficiency. Okay, so if you know some very depressed people out there who can't seem to move on, you might probably want to look at their tongue and take particular attention on the uh, front third. Now, what if, okay, in Chinese medicine, we almost always consider yin deficiency if the tongue body is red. Although, if you read Machocha, he would always say, it will take several years before the tongue becomes red. So, but most authors would agree because you don't actually consult when the symptoms are too early, di ba? So usually when the patient comes to us, they will probably have red tongue body. Okay. And there will be many small cracks, and then you notice that the anterior third is depressed. That means there is already onset of lung yin deficiency. So if you are to choose between lung qi deficiency and lung yin deficiency, you should opt for the lung qi deficiency. Okay. Patients with stomach yin deficiency will often show signs of lung yin deficiency. So, stomach yin deficiency, you don't see any coating on the center of the tongue. So, if you are, if you can relate to this, probably you also have lung yin deficiency. So, if the stomach fluids are injured or exhausted, the lung yin will be undernourished. Obviously, di ba? From the center goes to the front, no? So stomach deficiency that leads to lung deficiency, you can tell this because you will see a vertical crack along the midline of the tongue and also small cracks over the anterior third. But it doesn't reach the tip. Okay? So I hope you might want to start looking at your tongue after this. So if you are always sick because of wind heat, no? You always have sore throat or loud barking coughs, you have lung yin deficiency. Okay? And when you cough, you it's a bit annoying, okay? Because your cough is very loud. Okay? So that's lung yin deficiency. So persistent long-lasting coughing can injure lung qi. And so when the lung qi is injured, it will eventually affect the lung yin. So remember, when there is lung yin deficiency, you don't see any coating anymore. And what you see are cracks. And the worst thing that could happen there is the color of the tongue may be red. In feverish illnesses, okay, which means that the heat has entered the chi level and lingers in the lung and the stomach, the anterior third of the tongue will have red points. So I think this is very easy to understand. This will reflect either toxic heat or heat in the lung, meaning to say you probably have already a lung infection, maybe pneumonia. So I think we see a lot of these cases during the pandemic, no? But I don't think everyone would like the idea of getting near someone who was positive. So if you have toxic heat or heat in the lung, this can lead to lung deficiency because heat can injure the fluids in the stomach and the lung. And then specific tongue signs that indicate lung deficiency will be evident. Okay, so I hope that's easy. Okay. Now let's go to cases. We have a 31-year-old female. Symptoms, dry mouth at night, so very dry. Dry skin. Remember, the skin is called the third lung, no? So, okay, if you want to improve your skin, you need to look at your lung, okay? Constipation, so that's very dry. Bloated abdomen. So, background, long-lasting pertussis 1 year ago. Pertussis is whooping cough, no? Overwork and smoking. Okay. That's a problem with some people. They smoke a lot, they cough a lot. and so, and then they start complaining when they get sick. So, if you look at the tongue, it's pale and there are teeth marks. So, it looks thin to me, no? So that means there is blood deficiency or spleen chi deficiency. And then a vertical crack. You see this one? The vertical crack in the anterior third. Um, since the tongue is not yet red, so this is just an onset, well, which means that the early stage of lung yin deficiency. Red points at the tip. So there is heat in the upper burner. So when you talk about heat in the upper burner, that includes both the heart and the lungs, right? And then the coating is white and greasy. Okay. So there is food stagnation. Okay. White and greasy, cold damp. Next, another case, 31-year-old female, also dry mouth at night, dry skin, constipation. Yeah, I'm sorry. This is the same patient, no? I'm sorry. I think there was a duplication. Sorry. Okay, let us try to look into the case history of the patient in more detail. Mrs. S was 31 years old. She worked as a journalist. A year ago, she contracted pertussis. She did not react well to conventional treatment and suffered for weeks with coughing fits. She continued to smoke during the illness, however. Since then, her skin felt very dry. Remember, the skin reflects the lung condition. She was very constipated. Remember, the lung is interiorly, exteriorly related to the large intestine. Remember? Metal element. Dry stools. She also complained about severely bloated abdomen. Tongue body was pale and showed crack in the anterior portion. The pulse was noticeably choppy because there's, as you can see, the tongue is very pale, no blood deficiency. Okay. Mrs. S was very healthy until she contracted pertussis. This is reflected in normal tongue shape. Okay, pale tongue and choppy pulse indicate blood deficiency. Choppy, just like the signal of some of our networks. White greasy tongue coating will point to food stagnation. Okay, what causes the food stagnation here? Because of hectic eating habits at work. Some of us do not uh, would eat while working. So your brain will get confused, no? So and you deplete the energy of the chi of the stomach, okay? Because you start thinking about work and all these things. Food stagnation disrupts the downward moving actions of the stomach chi, and so this will cause abdominal distension. Okay, the constipation was due to lack of blood to moisten the intestines, plus lack of the descending stomach chi. Okay, the vertical crack in the anterior third of the tongue is associated with pertussis because this is the lung area. Both injured the lung yin. Okay, and the patient still continued to smoke. So this gave rise to heat in the lung, which was an additional contributing factor. So in Mrs. S, lung yin deficiency manifested as dryness, that is, dry mouth, skin, and stools. Next, we move on to the next one. 38-year-old female complaining of difficult breathing, dry mouth, thirst, night sweats. So night sweats, yin deficiency, no? Restlessness, tendency to catch colds. Western diagnosis, chronic tonsillitis with abscesses of crypts. That is why I was asking someone to show us the tongue of the child who was supposed to have tonsillectomy, no? So we might be able to help the child, okay? If we'll just try, Kripa. Allergic rhinitis, bronchial asthma. Background, see, repressed emotions, especially grief and feelings of guilt due to having given birth to a handicapped child. Okay? You should not feel guilty. Family history of respiratory diseases. So the tongue here looks red. The tongue surface is rough. It's magaspang. The edges are red, no? So when you have a reddish rough tongue surface, reddish, think of kidney yin deficiency, okay? It takes time because the kidney yin is the root of yin of the body, no? The source of yin of the body. The red edges, what do the red edges tell us? There is liver heat. Okay? Deep irregular crack in the anterior third, So now we know the diagnosis is lung yin deficiency. Okay? Deep red spots. So this is not just an onset. This is still not, this is not anymore early because the color of the tongue is already red. Okay? Deep red spots at the tip. So that means there is long-standing toxic heat. Toxic heat means you have infection. Okay, probably pneumonia. Yellow, thick, greasy coating at the root. Okay, so there is damp heat in the lower burner, and we all know that lower burner consists of the when you talk about the coating, you just talk about the young organs, not the kidney, right? So we talk about the bladder, the large intestine, and the small intestine. When you talk about the color of the tongue body, that's where the kidney should be considered. Okay, let's study further the case. Mrs. L, 38 years old, appeared exhausted. She looked after her physically and mentally handicapped child night and day. So that was very, very stressful, no? Her marriage had become strained because she spent too little time with her husband because she spends more time with her handicapped child, no? Sadness, feelings of guilt, and deep-seated anger over her circumstances determined her emotional life. For months, she suffered from restlessness and night sweats. After emotional stress or physical exertion, she felt tightness in the chest and occasionally experienced difficult breathing. She was susceptible to colds, suffered from frequent tonsillitis. She's already 38, no? It's very unusual for an old an adult to have tonsillitis already. She was therefore unable to cope with tasks of her life. Tongue coating was yellow and greasy, especially in the posterior third. Deep, irregular, vertical crack in the anterior third of the tongue was noteworthy. Tip of the tongue showed dark red spots. Edges of the tongue were red. Her pulse was rapid, which is understandable because the tongue is red, no? Rapid and wiry. Okay. Wiry means there is an issue already um, with liver. Okay. Remember, liver, gallbladder. Mrs. L's unresolved emotions. Of course, the liver is involved because of the emotions. This caused liver qi constraint. So when the liver qi is constrained, that means it's not moving, there will be heat in the liver. So what will this result to? There will be red edges of the tongue and the pulse will be wiry in quality. Her long-standing sadness is lung. So this injured both lung qi and yin, and this led to the asthmatic attack. So that's why we need to have we need to hone our skills in really extracting the history. For all you know, the asthma attacks is probably due to some emotions, no? Unresolved grief. Okay, tongue reflects both of these pathologies quite clearly. The red edges show liver heat, while the deep vertical crack in the anterior third of the tongue indicates lung yin deficiency. So lung qi and yin deficiency contributed to her tendency to catch colds. So sore throats, inflamed swollen tonsils, dark red points at the tip of the tongue, toxic heat, which was retained in chronically inflamed tonsils. Underlying kidney yin deficiency gave rise to heat, and then this was manifested as night sweats, while heat in the liver contributed to accumulation of heat in the interior. So because there was heat, this caused the dehydration, the depletion of fluids. So the patient had dry mouth and intense thirst. Greasy yellow coating on the posterior third of the tongue means there is damp heat in the lower burner, which has not yet caused any corresponding symptoms in the patient. Lung yin deficiency will always lead to dryness and or heat. No? As a rule, this will be reflected in changes in the anterior third of the tongue, redness, dryness, and formation of cracks. Appearance of any of these tongue signs should be a signal to abstain from eating spicy, hot foods and herbs, and more importantly, from smoking. All this will have a drying and heating effect on the body. Okay, I guess that was too much. Okay, let's now go to assessment. Very easy. Okay. May I call on Doc She from Palawan? How is Palawan, Doc She?
Hi, Doc. Good afternoon.
Good
Everything
afternoon.
is fine.
Wow, good to hear that. You
Yes.
look fine also. You lost like, I think, 10 kilos. Grabe.
No, not yet. No, not yet.
I hope you don't have cancer.
Wood! Knock on wood.
Just kidding.
I have a lot of children.
I was just kidding.
Parang,
I was just kidding.
parang pumayat ka na.
Payat siya. Grabe siya.
Pumayat na siya.
Ay,
Dok,
Hi, Doc Che.
Hi, Miss Trix.
ang ganda-ganda.
You look great.
ako
Payat-payat.
parang gusto ko nang pumayat ulit.
Let's all get fit.
Okay, so can you do the assessment, Doc She?
Okay, Doc. I'll try my best.
Yes. Okay, white tongue, what pattern?
Cold pattern.
Wow, okay, automatic. Yellow tongue.
Full heat or damp? With dampness. Ang yellow.
Usually you can have damp heat here, no? Um, Yellow, that okay. Or full heat. Yeah. Gray, black, and wet tongue. Remember, wet, it's not dry. Okay?
Extreme cold.
Yes, because wet. The tongue should only be moist, not wet. So if it's wet, even if it's black, you might think, okay, the color is black. There could be um, heat, but remember the tongue is wet, so it's extreme. Okay? A gray, black, and dry tongue indicates this is often caused by medication, especially when you're into H2 antagonist, Pepto-Bismol, no? Gray, black, and dry.
Extreme heat.
Yes. The amount of moisture on the surface of the tongue indicates the state of,
Body fluids.
yes, hydration, body fluids. What is the level moisture of a tongue that indicates body fluids are intact and there is proper TNT, transformation and transportation?
Dalawa daw kung wala daw discount.
Normal.
Is
Normal siya, Doc.
so it should not be wet, it should not be dry. No? It should be very slightly moist, very slight. Okay. What is the level of moisture of a tongue that indicates young chi is not able to do TNT and this accumulates to form dampness?
Too wet or much wet talaga
Okay,
daw.
very wet.
Very wet.
What is the level of moisture of a tongue that presents full or empty heat according to the coating?
Dry.
Very dry.
Dry.
What is the level of a moisture? Sometimes it looks yellow, no? What is the level of moisture of a tongue that presents
Yeah.
retention of dampness or phlegm?
Slippery or sticky tongue.
Okay, so if it's slippery or sticky, uh, it's damp. Okay, it's not really dry. There's yeah, slippery. What do mouth ulcers indicate? So we see a lot of patients complaining, like they have this. I forgot the term in Tagalog. Singaw, ano yung parang ang mouth ulcer,
Yeah,
mouth
tama. Sinaw.
sugat-sugat. Okay, what do they indicate?
Heat toxins daw.
Okay, so they should be able to address the there could be infection already. Okay, thank you so much, Doc She. That was
Thank
very
you.
pleasure to see you losing a lot of weight. Oh my gosh. Maybe you can share your secrets later. Okay.